I want to move on to recognize my Shiro, one of my Shiros, and like our local Dr. Fauci, the most incredible woman, leader, soulful, amazing human. I'm going to talk a little bit more about her after the video, but I would like you to learn a little bit about her through this incredible video montage of a bunch of humans who love her, respect her, and are so pleased that we're honoring her as our event honoree tonight. So, Dr. Sara Levin, I know that you know how much this community loves you. I hope that you will pay attention tonight uh, as you hear from not just me, because I know you hear from me a lot about how much I love you and how much I appreciate you. And I know you hear from Nicole, and I know you hear from Susanna, and I know you hear from many of us in the nonprofit community, because we haven't had a doctor in the health system that prioritized elders in the same way that you do. And it's unparalleled, your heroism, your leadership. And please see how other people feel as well.
Hi, I'm Senator Bill Dodd. Hello, fellow supporters of Choice in Aging. I am joining you tonight to pay homage to our Deputy Public Health Officer, Dr. Sara Levin. Dr. Levin was a model for all health officers to replicate in her emergency response to the pandemic. You know, when the pandemic first broke out and the outbreak happened in a skilled nursing facility in Contra Costa County, Dr. Levin got to work assembling a strike team, ensuring PPE was distributed, and crafting a playbook on spread prevention and containment that became a national model of care for congregate living sites.
Hi, Choice in Aging supporters. I'm Rebecca Bauer-Cahan, the Assembly member for the 16th Assembly District, and I just wanted to join you in thanking Dr. Levin for her incredibly hard work during the pandemic to keep our most vulnerable seniors safe and educating their caretakers to make sure they had everything they needed.
She has been instrumental in setting up mobile vaccination clinics at HUD housing complexes, as well as other senior living facilities. She also helped ensure that so many homebound seniors in our community were receiving access to vaccines. She has remained a true partner with our community-based organizations throughout this time and has always put access to care as a top priority.
Dr. Levin, you led the enormous effort in Contra Costa County to get the most susceptible members of your community tested for COVID-19 and then vaccinated through mobile clinics. Your concern was real. You said, quote, "Where we've seen a lot of spread is when staff in these low-wage jobs are working in multiple facilities to ensure their financial stability and without benefits that don't necessarily allow them to have sick leave. You created a playbook for frontline workers, and you shared that playbook with us at the state."
Thank you, Dr. Levin, for advocating for the congregate care facilities in our community and developing the strike team. Your work is truly inspiring, and we appreciate you.
Thank you, Dr. Sara Levin, for sharing your amazing teaching, your passion, your empathy, your sense of humor, your compassion, and your advocacy with the most vulnerable of Contra Costa County. We thank you.
Sara, thank you for being such an amazing advocate for seniors, for congregate facilities, for all the staff, for all the frontline workers who've done an amazing job during this pandemic, and for putting together the congregate care handbook. You're an amazing person, and you really love patients and seniors especially, and thank you for doing all that you do.
Thank you, Sarah Levin, for all your late night emails where you shared all your anxiety and worry about the fragile elders in our community, but also shared all the great recommendations and practical solutions for how to protect those individuals. Thank you.
Sarah, thank you so much for all you've done taking care of older people here in Contra Costa County. You've made life a little bit better for those who live in congregate care during this difficult pandemic.
Hey everybody, greetings from Washington, D.C. I'm so excited to come to you today as we honor Dr. Levin and all of her accomplishments, her love, her tenderness, and her tenacity to serve the seniors of Contra Costa County. I got to know Dr. Levin through the pandemic as we worked together to serve those who live in long-term care. And what I appreciate most about her is her willingness to collaborate with people from a broad range of community-based organizations and her willingness to challenge assumptions to save lives.
Hi, Choice and Aging supporters. I'm Caitlin Sly, Executive Director with Meals on Wheels Diablo Region, and I wanted to send in this message to thank Dr. Levin for all of her tireless work on behalf of seniors over this past year. As service providers, we have relied on her knowledge, patience, kindness, and willingness to be a voice for those who are so often forgotten in our community.
She has been throughout this entire pandemic a voice of reason, a person that you could go to and ask your questions and know that you were getting the best scientific, most up-to-date information. I've seen her on multiple Zooms. I've seen her present. She's very calm. She's very reassuring. We're going to get through this okay. And yet she's been sharing information that's been critical to the entire community.
Congratulations, Dr. Levin, on being this year's Choice in Aging honoree. For the past 2 years, you and your team have worked tirelessly to ensure that our older communities have the protection possible against the pandemic. Your work has been both inspiring and a model for other agencies to follow. So thank you so very, very much for all the work you and your team have put in. It's truly an honor to have you on the Contra Costa team.
Few of us can say that we've ever had the privilege to save someone's life. And what Dr. Levin can say is that truly she helped save the lives of nearly 10,000 people who live in long-term care in our community. And I am so glad and so excited to see her honored here today. Dr. Levin, all my love and appreciation to you from the Empowered Aging team.
Thank you, Dr. Levin, for being a true superwoman, and congratulations on your honor tonight.
Along with my colleagues on the Board of Supervisors, I want to thank her for her incredible service to Contra Costa County. Again, we are so lucky to have her as part of our community.
I heard you once say, the way we deal with it is not dealing with it. Well, Dr. Levin, you dealt with it. You stepped up to the plate, and that's why I'm here to thank you and to honor you for the critically important work you have directed. Thank you for your heroic leadership during this pandemic. You lead with your heart, and you make all of us in public health very proud. Thank you.
This recognition is so richly deserved, Dr. Levin, and we are so incredibly fortunate to have you in our community. And you save lives every single day, and you lead with science and dignity. You are a model for all of us to look up to. Thank you so much.
Well, she's our community's Dr. Levin. Dr. Levin, I'm putting you on the screen and I didn't tell you I was going to do that. I apologize, but I hope that you feel all the love and all the gratitude, not just from us, your followers and your stalkers and your fan club here in Contra Costa, but your work is recognized above and beyond Contra Costa in the state and in the nation. You are truly a blessing to all of us. So thank you.
So do I have a couple minutes?
You do. Go for it.
So when Debbie told me that she wanted to honor me, I felt mixed about it because, you know, most of us have an imposter syndrome. And I felt like the work I did in the pandemic was the work that was my job, was what I was supposed to do. And I'm so honored and humble to receive this tribute. And the honor comes from just feeling like maybe I don't deserve it, because there's always more to be done. I could have done better. How could I have done better? And the humbleness comes from like the work that I did in the pandemic was inspired by the people I got to engage with, Choice in Aging, Debbie Toth, all of you who are here today, who do the work tirelessly every day. And it elevated the work of the health department in a way that we didn't have vision for before. And so I just hope that the pandemic teaches us how to do our best inspired work going forward in a way that cares for the construction of a society and a county and a community that we want to live in. And it was so wonderful to hear Fiona Ma talk about sort of a vision for the state of like, how could we create multi-generational communities that are supported for everyone to be able to receive the wisdom of our elders and the growth of our children in this way that creates the healthiest possibility of who we are all within our limitations. And I just feel humbled that I don't think I could ever do this work again without the collaboration and the guidance and the co-design that happens from truly engaging in a platform and building of community that happens with community-based organizations like Choice in Aging, and with individuals who are in positions of power who can guide those resources towards the most important things we need to fund at a state level, because we don't know what's going to happen from a federal level. So
Right.
that's all I'd say. I love you, Debbie Toth.
I love your guts. You know it. You know it. Every bit. Thank you, Dr. Levin. We have a lot more work to do together. So thank you. And you're not an imposter. You are the best poster ever, if there was such a thing, since you're not an imposter, but you are the best poster ever. And yeah, we need to continue to elevate the partnerships. You're absolutely right. So thank you, Dr. Levin. And we are going to, I hope everybody shares their gratitude for Dr. Levin, like I'm seeing right now in the chat.